Now it's time for a pitch session. We'll have two pitches during this conference today and tomorrow morning too. And I remind you that you can connect and B2B match to get some B2B meetings during the conference and also tomorrow afternoon after the conference. So let's start the pitch session with Muriel Vayssier Taussat. Muriel Vayssier Taussat, you're a Director of Animal Health Development at INRAE Prezode, and you're going to introduce the challenge of emerging infectious disease prevention.
Okay, thank you very much, and good afternoon to everyone. So, since the COVID crisis, it's not necessary to spend hours to explain how emerging infectious diseases are important, and also why it's very important to try to prevent emerging infectious disease. So in a few words, I will just say that first, as Serge told us, outbreaks of emerging infectious disease are still increasing, that the majority of them have an animal origin, so we can speak about emerging zoonotic disease. The causes of the emergence of this this infectious disease are very complex and depend on many factors, and all this and it's also dependent on a very large variety of local situations, and these zoonotic emerging infectious disease are often, not to say always, linked with human activities. So now the emergency is to find a way to stop the increase of this emerging infectious disease, and to be able to prevent the next pandemic, the next epidemic. So how can we do? I hope it's going to. Doesn't work.
You should click once on the presentation, then you use.
Okay. Okay. So what to do to try to prevent emerging infectious disease? First, we need research. We need research first to understand how these infectious diseases emerge in a changing world. So actually, we need to understand the factors involved in the emergence of pathogens and disease they cause. And these factors could be loss of biodiversity, the changes in agricultural practice, the changes in land use, climate change, also human and animal behavior, etc., etc. So it's very important to understand these factors, to, when we know them, to try to act on them to mitigate or to decrease their impact. Another important topic is to understand how microbes, how pathogens can jump from one species to another, and more precisely in this case, from one wild animals to domestic animals and or to human. And also, how do they spread? How can we explain their evolution, their ecology, etc. And when we understand this aspect, we also can act on them to try to avoid the spread, to avoid this species jumping. Another important need of research is to detect very weak signals of sport of emerging infectious disease. And the idea here is to put out the fire before it spreads. So for that, we need better surveillance systems in animals, of course, but also at the animal and human interface. And for that, we need to develop new innovative technologies. And actually, again, yes, but so we need research, but as a lot of people said before me, and especially in this roundtable, classic research only is not enough to answer to this very complex question. So we need, yes, because to tackle this very complex question, we need to bring a lot of expertise coming from different domains to find answers to very, very complex questions. So we need interdisciplinary project. We also need to cooperate at the international level, since you can have a pathogen that will emerge somewhere in the world and causing an epidemic, a pandemic somewhere else in the world. So we have to work at the international level and find a way to share data from different projects and from different surveillance systems, etc. And finally, and also very, very important, we also need in this project, in this research project, we need to involve policymakers, decision makers, and also society at all steps of the project to be sure first that we address the good questions, and also to be sure that the findings of the research project can be used, will be used. And actually it is, and I come to Prezode because it's actually the ambition, the objective of the Prezode initiative. So the Prezode initiative, in few words, because I have only 5 minutes and it's very short. Oh, sorry, I have to go back. So the ambition of this international Prezode initiative is first to support or conduct research project to understand risk of emergence of zoonotic disease, to also develop methods to improve the prevention of emerging infectious disease and also sorry, the early detection of the pathogen emergence. The Prezode initiative proposed also a kind of framework for international research projects, but also for international operational projects and networks where we can share knowledge, and this knowledge could be used by decision makers to implement public policy to reduce the risk of emerging infectious disease. So I think that I am almost, I finished my 5 minutes. And so if you want to know more about this Prezode initiative, you can contact the team using this, the email on the slide, or directly go on the website. Thank you very much.
Thank you very much for this presentation, and we know more now about Prezode. Thanks a lot to Muriel Vayssier for your presentation. Now let's switch to another pitch, a new pitch with Céline Dupuy, your coordinator of the French Animal Health Epidemiological Surveillance Platform, AHESP from ANSES, and you're going to present the French Animal Health Epidemiological Surveillance Platform. I just talked about AHESP. Your turn, thanks.
Thank you, Fabrice. Good afternoon to everybody. So I'm going to present you the French Animal Health Epidemiological Surveillance Platform and explain you how we are working in a One Health approach. Our scope is surveillance. We are not performing any risk assessments, reference research, or risk management, but our data and our work can feed these other sectors, and in return, results from this sector is very useful for us to improve our surveillance. To very concretely have this synergy with these other sectors and create this collaboration, we include in our working group experts coming from these sectors. Our objective in the platform is to improve the efficiency of the epidemiological surveillance. For that, we develop, adapt, and promote surveillance systems. We also implement national and international epidemic intelligence, and we perform synthesis on epidemiological status of health hazard. We supply technical support for surveillance system, but in no case we are taking decision for this surveillance system. We use an innovative approach with our steering committee that bring both private and public organizations. So we have a combined private-public governance of the platform. The steering committee validates our action plans that is implemented by our working groups with the support of a transversal team. The other thing that is very innovative is the fact that all our work is performed using 3 values. The major one is the consensus, which is very innovative, and we also obviously have interdisciplinarity and collaboration. As you can see on this slide, we are working in quite wide areas with a lot of field for which we are working with 29 working groups. These groups, for this group, we have nearly 200 technical experts from 56 organisms. For the One Health approach, we really implement our work with this concept since the creation of the platform in 2011 on zoonotic diseases, of course, but also for potential zoonotic diseases and for all diseases that are common to domestic and wildlife, because for this disease, you really need to take into account the environmental sector. We had recent evolutions that helped us to go deeper in this One Health approach with the introduction of the National Public Health Agency as member of our steering committee. There was also the creation of the 2 other surveillance platforms, one in plant health and another one in food chain surveillance, which enable us to start new working groups common to our platform on methodological aspects or on specific diseases such as salmonellosis. I will finish with a feedback on the way we implemented One Health. And for the first point is that there is obviously not one way to do One Health. It is more a case-by-case approach. For instance, in our working group, we can have 2 ways to do it. One way is to include directly technical experts from all sectors in the same working group. But another possibility is also to have each sector in a dedicated working group and be sure that there is continuous link between them. We also think that a step-by-step approach is certainly slower, but more sustainable. For instance, we start with a working group considering at the beginning one sector, but after we can include step-by-step experts from the other sectors. It gives us the opportunity to have more time for acculturation between the different experts, which is very important. We, of course, faced this difficulty of the well-known alone I go faster. So we have to demonstrate that it's an added value to work together. For that, we start implementing small concrete actions with the different experts from the different fields. And it allows us to demonstrate that there is an added value to work together with no additional burden. And after that, it's more easy to demonstrate that alone I go faster, but together we go further. We also think that it's better to start working in space-time because you need to take time to learn working together, and it's more difficult to do that when you are in crisis time. For that, the platform is very good because we are working on a mid-term, long-term period. So our experts know that they have time to know each other, that they will not work only during a crisis period, but during a long time. So they can do the investment to work together. And the last point is that the 3 national epidemiological surveillance platform is, of course, a new suitable environment for a sustainable and concrete One Health approach. To conclude, I can say that we already have done some actions, but there is still a lot to do to go further in this One Health approach for surveillance. Thanks a lot.
Thank you very much, Céline, for this presentation. I'm sure that it's difficult for you, all of you, to stay into 5 minutes because it's very short to talk about such important topics. But unfortunately, we have to follow the rules because time is going by very quickly. So now it's time for François Loïc Cosset. You are director of CIRI, and you're going to talk about the LabEx ECOFECT, primordial seeds in One Health research on infectious diseases in Lyon. So you get 5 minutes. Thank you.
Good afternoon. Can you hear me?
Yes.
Okay, good. And thanks to the organizer for inviting us to present in this speech the ECOFECT LabEx, which runs until the end of 2022, which we believe has provided many primordial seeds in the One Health research initiative in Lyon, and particularly on infectious disease. So this LabEx started in 2012 and was co-funded by Dominique Pontier and myself with an overall budget of about 8 million euros. And Isabelle Weiss has been his chief project since 2017. So the ECOFECT LabEx is affiliated to several institutions, which are shown here, and gather 6 research units, 34 teams, and 250 people that altogether aim at developing integrative approaches to understand infectious disease in ecosystems and societies, with the hope that it will ultimately help fighting against specific group of human pathogens before they become responsible for epidemics, or even better, before they have a chance to be transmitted to humans. As discussed by others during their presentation at this conference, our general philosophy at ECOFECT is based on the idea that the impact of infectious disease is a result of many interacting mechanisms. Some of them ultimately affect the health of humans. For example, human health depends on the healthy animals environment and vice versa. And that is the reason why ECOFECT is part of the One Health challenges. Such interdependence between living ecosystems is even more important when considering that global changes are likely to accelerate the emergence of infectious disease and their spread worldwide. Such changes being, for example, those linked to climate change or habitat losses that induce spread of invasive animal species or vector species into new areas of the world. There are plenty of examples for this. In this context, one of the objectives of the ECOFECT is to understand the specific selection pressures on infectious disease that are linked to these changes. And this implies to accurately study pathogenic host-microbe interaction at different scales and different organizational levels, from molecular and cellular levels up to population and host communities. And we believe that this is only by fully understanding and integrating all these mechanisms that we can hope to fight against or to prevent infectious disease. So we thought that to achieve these knowledge objectives, the collaboration of several scientific communities was needed to jointly develop these programs. Clinicians, microbiologists, experts in structural biology, immunologists, ecologists, evolution biologists, and methodologists. And for this, we have stimulated tight interaction between researchers from these different communities via a strong scientific animation program, such as summer schools, seminars, and thematic workshops, or via funding of master and PhD fellowships. Another essential approach, of course, was in the launch of calls for tenders and to fund peer-reviewed interdisciplinary projects. Also, to facilitate the development of this project, at ECOFECT, we have launched and developed 3 highly innovative technical platforms and facilities on which the ECOFECT community could rely on. First, a field vehicle equipped as a mini laboratory to undertake preliminary characterization of microbes collected on the field. Second, chimeric mouse core facility, allowing to study pathogens on a humanized small animal model environment. And third, a spinning disc confocal microscopy facility to achieve 4-dimensional imaging of living infected cells in a BSL-3 laboratory. The projects that we selected for funding have allowed to structure the ECOFECT community around 3 main axes. First, the emergence of infectious disease pathogen transfer and pandemic risks. Second, the co-evolution of microbial interaction, and third, the resistance to antimicrobial treatments. All the projects that were funded were collaborative projects associated 4 to 6 teams on average, and combining ecology, evolution, methodology, and infectiology. And we have also guided the team all along the processes to construct optimal and high-impact projects with the help of our scientific committees and of the external scientific advisor of ECOFECT. And the major pathogens addressed were Zika, dengue virus, HBV, flu, SIV, staphylococcus, or antibiotic resistance. We have also financially supported 3 patent-based proof of concept projects, in particular in the field of development of inhibitors, vaccination, and genome editing technologies. And currently, ECOFECT still has 2 large ongoing projects that gather each 5 to 10 teams, on which are co-funded also by the IDEX Lyon. The first one, led by Xavier Charpentier and Samuel Venner, aims to understand the genetic and eco-evolutionary basis of carbapenem resistance by using the Acinetobacter baumannii as a model system. And the second one, which is called by Vincent Legros and Jean-François Lemaitre, which aims to study the Crimean Congo hemorrhagic fever virus to discover potentially new neuroviruses, pathogens, and to better understand the molecular and ecological ways of tick-based transmission of arboviruses. Okay, I'll finish here, and thank you very much for your attention. And if you have any questions, feel free to ask them to myself or to Dominique. Thank you.
Thank you very much, François. It was a perfect 5 minutes long, really great. Thanks a lot for your presentation. So let's continue now with Benoît Miribel. Benoît Miribel for a new 5 minutes speech. Are you in line, Benoît? Can you hear me? You're Secretary General, One Sustainable Health for All Foundation, OSH Forum. Yes,
that's
okay,
right.
I can see you, great. So now I give you the floor.
Thank you, Fabrice. Thank you for the Hub VPH for the invitation to introduce you this new initiative that was mentioned by the mayor and by Serge Morand, because he's part of this initiative. So in a few minutes, just to can launch the, okay, that it works. So this is the first slide. So it's an international initiative that aims to gather different organizations and experts to work together for somehow make the One Health approach more concrete in programs at the field level. So of course, we stick to the definition, to the recent definition. We have launched this initiative last year. It was through the World Health Summit, the Fondation Une Santé Durable pour Tous, that is, by the way, located in Lyon here, and we started to agree that by focusing on the SDGs and considering that an acceleration could be to work in a more transversally, considering that we have too many silos. Not talking only about the scientists, because the scientific and industries, but also with NGO and also those who are doing the regulation, the rules, by the way. So we want also to make sure that we do the link between human health and environmental health. So we started last year early with a scientific advisory board, and you may recognize some people that you know, for example, Serge Morand, so some very good experts coming from different parts of the world, and all committed and working to share a common objective that we need to have an international working group for a long period. So it's about 1 year, one or 2 years, to try to better know each of them and to propose concrete operational programs somehow. So we have decided to launch this 7 international working groups. They started in July. It was from Euronews, but we launched it. And they are working for the moment. And so I'm not going to develop too much, but you see that we try to cover a broader scope related to the One Health. This is why we call also One Sustainable Health, because we want to stick to contribute to SDGs. We consider that the One Health is a way to accelerate the SDGs also. So, of course, the experts that are working in the working group work with independence. It's a Chatham House. It's the group together, because sometimes we are all working for an organization, and it's good sometimes that people just bring their expertise. And we have also, of course, some organization, but to separate sometimes the expert and its organization, to make sure that we try to go beyond the silo. So this international working group deliverables are advocacy about sharing a vision, an integrated approach. We believe a lot in the integrated approach. Operational recommendation and projects. So we are focusing on implementation, research, of course, multidisciplinary research, education and communication to share knowledge, and ethics, common values. So we aim to communicate next year a declaration on One Sustainable Health that will be a concrete approach, concrete recommendation from the experts, like we know that it's necessary today, and it was before. So the international working group has 1/3 of scientists, 1/3 of specialists implementing programs and activity. Or, for example, we have NutriSet also, which is a company, and we welcome other companies, of course, because we consider that it's public and private actors that need to work together, and regulation. So I'm reaching the end to show you also the strategic partners, and we welcome from different kind of partner. And so again, we will invite you next year. We have the support of different personality, and we'll have soon, February 8th, a conference to bring recommendation building European Health Union, and it will be a way also for us to promote the One Health through that conference. Thank you very much.
Thank you very much, Benoît, Miribel, for this short presentation. Now we have a video pitch from Nathalie Guerson. She's head of NCV FIV, BPH chair, and she will talk about One Health formation. Coming soon.
As director of the National School of Veterinary Services and France Vétérinaire International here in the campus of VetAgro Sup in Marcy-l'Étoile, I'm pleased to present you training and expertise that we carry out on the field of One Health. The National School of Veterinary Services provide training in veterinary public health field since 1973, and it's OHE Collaborating Center since 2004.
As a result of our research in sociology and economics, Christophe Després, Sébastien Gardon, and myself launched 2 years ago the One Health in Practice diploma. The diploma is the only training course in France aimed at human, animal, and ecosystem health professionals and based on concrete cases of governance and management of health issues. We have a rich pool of academics and experts with very different professional backgrounds and international partnerships. An international version of this course will soon be available.
Interdisciplinary training in the field of One Health must also concern all public decision makers. which is why the French government has decided to establish a core courses for the training of official servants within the framework of the creation of the National Institutes of Public Service. In this context, the UNSV has developed, together with the School of Human Health and other schools, a roundtable on the theme relationships with science in order to promote the use of scientific expertise in public decision-making and the link between risk assessment and risk management, to explain the difficulties of public decision-making in situations of uncertainty and in particular crisis management, to stress on the relationship with society and the interests of citizen consultations. And finally, to illustrate the difficult articulation between science, innovation, and society. Another theme related to the ecological transition also stresses the One Health Environment component in order to raise awareness of the issue among all senior officials and not only the officials of the Ministry of Ecological Transition.
Cycle des hautes études en santé globale is a joint training proposal for civil service officials at the collective initiative of the School of Public Health, School of Engineers, Frauds, veterinary schools, and INSV FEI. The challenge through this training is to provide a transversal and multidisciplinary vision, as well as a necessary rise in the field of global health on a territorial, national, and international scale. The objective is to improve the coordination of services in the prevention and management of risk, to initiate networks, to provide knowledge and skills in the field of environmental health by providing theoretical and practical tools.
Supported by the VetAgro SUP VPH Chair, the UNSV FVI, the UCBL1 and private partners, the Master One Health, Managing Health of Populations, cover a broad range of One Health topics and call for interdisciplinary and intersectorial action in the management of public health problems. The Master is conceived as a one-year course, 6 months training and 6 months internship. It includes as a common core curriculum and 2 specializations options in risk assessment and risk management. The course is targeted both at students in medicine, veterinary studies, economics, ecology, social science, and at working professionals such as official veterinarians, doctors, health managers, and economics. The career opportunity include all types of health professionals involved in risk assessments or risk management. The course is taught entirely in English and has a large network of actors, contributors, and partners.
In terms of One Health initiatives, the NSVVI collaborates with many countries. International Action Service offers since 2014 face-to-face or remote continuing trainings intended for an international audience of decision makers from the veterinary domain. The priority objective of our trainings is always to contribute to the implementation of the OIE standards.
The projects developed in the One Health field aim to meet 3 main objectives: interdisciplinarity, prevention and risk management, the practical application of the One Health concept through concrete example and work, which is for me a priority.